Today I have a case of an unfortunate lady. She had a facelift done somewhere else. Didn't like the results, so she went back, and the surgeon, I think, what sounds like, I don't have the notes here, did liposuction to help with the neck so she feels better. Immediately afterwards, she had right-sided marginal completely out. So it's been almost 5 months or 6 months now, and it's still not back. So she's obviously very concerned. She saw my video and she came to check. So I'm going to check and see if there's any movement. If not, I'll try the stimulation. I have a stimulation stem pod that came with actually Therapeutic, so I use it for finding the nerve. And I am going to look for the nerve and see if it is functional or not. So let's take a look. We have a very sweet, nice 60-year-old, beautiful female here. This lady is very pretty, and she decided to have a facelift done, and it was, I think, a few years ago, and she didn't like the result. So about 6 months ago, roughly, she had a revision for the neck done with liposuction. And right after that, she noticed that the right lip does not move, right lower lip. And she obviously was very concerned, and I think she contacted me through internet, and then after that I gave her some advice, and she has been doing some stuff. But we wanted to check and see if the nerve is intact or not. As you can see, it really doesn't move much. Even at rest, you can see the difference. So now I'm going to have her try to blow a whistle. That's good. Now I want you to smile. Good, 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 good. Okay, great. So smile with your mouth open. So now you can see that there's something going on there, but not really much. So, but she wanted to confirm if the nerve is intact or not, and we are going to use stimulation, electrical stimulation, to see what we find. So, okay, so there we go. Oops, right there. I saw something right there as well, right there. So this is a lot of movement going on, so that you can't relocate. So the good thing is right there, we tell this movement. So that's fantastic, which means the muscle, the nerve is still intact. Now I have to reduce it a little bit, the intensity, and see if it still works. So I went down to 2 milliamps and we can't find it. But that's what we gotta do. Okay, so let's go up a little bit. 3 milliamps. Okay, 4 milliamps. And I've been checking it earlier, and that, can fatigue the nerve as well. So probably should have done the video earlier. Okay, 5 milliamps. There we go. I see the movement. Look at the chin over there, please. See this movement right there? Excellent. So there's something right there. And see the movement in the chin? Okay, so let's increase now to 6 milliamp. Let's see what we can find here. Oh, right there. So it was a little lower. So we got it right here. Right there as well. You can see the movement. Perfect. Still the movement. Right there, the movement. So this is exactly where the facial artery is, and that's where it usually crosses over. It's a movement on the chin, you can see right there. So that tells us that indeed there is. So okay, so we have marked the path. Let's see over here, little movement there as well. Could be more than one terminal branches here. So this is the area right here, right there as well. Nothing there. Right here as well. Okay, there. Not as much. Okay, so now I think that, yep, right there. Good. Nothing. So we have mapped the nerve. Now we just gotta show the patient exactly where to go. Okay, so if you follow this right here, this is the way we have found the nerve to go, right there. But we do see almost like here and here. And you see movement. Yep. Movement, movement. This is too close right here. It could be just the muscle being directly stimulated, but for the nerve right there, that's the nerve. That's the nerve. Okay, so now this mark, we know it's definitely working, and that's such a relief. The good thing is the patient is very smart. She's very smart because she spoke to me on the phone, I don't know, almost like a month ago or so. And then I told her to get a stimulator and a massager, and she started doing that, and that has definitely helped with this area. I'm going to quickly show you what she has, because anybody else in need can get this electrical stimulator from Amazon. And Stephanie, if you can just show this, please. Hand holding high frequency instrument. Basically, this is a massager, and this is the Meridian Energy Pen, which is basically a very mild electrical stimulator, W912. And she has been using it very wisely, and I'm going to now try to see if this is on 0, so we can increase the number. And it was working great. Problem is the nerve is now fatigued from the high stimulation that I've done. Otherwise, when at home she uses it and she just touches it right there, it starts moving. But right now it's not doing it only because the nerve is fatigued.
Maybe put on 9.
It is on 9 actually all the way, but my stimulation was very strong. So let's see maybe on this side.
It would work very hard.
I don't know, it's not working right now. So
maybe it stopped. Maybe the battery is.
Could be the battery or something. So anyway, but this is the unit, and I saw it was working earlier. It's a really good unit. So it's worth using it to stimulate the nerve. And then also I'll show you the massager. So you can see, so this is just a massager right there. And does it vibrate or no?
Yeah, it's vibrate.
So from the bottom, yes. So this is vibrating now. So you can use that on the muscle to stimulate as well. So between this for a massage and the electrical stimulator, you should be in good shape. And I'm pretty confident this lady's gonna have a nice recovery. Thank you, and hopefully she'll send us more photographs and videos once it is doing really well. Okay, so actually she was able to make it work. She's a magician as well, so she was very good with that. There, she's laughing now. Yes, yes, yes. So there we go. Okay, let's see how you do it with this electrical stimulator. She found the marginal all the way deep. You can see there, right there, and the lip moving as well. Perfect. So it most likely, actually not most likely, it definitely is the nerve, because it is far away from the depressor anguli oris. That's the muscle that Judy's not working. So this is definitely working and doing very well, and I think that's a good idea. And the nerve can get fatigued in a little bit, which is not a bad thing. You don't want to overdo it, but this is a good way to get the nerve going.